I'm demonstrating now the thumb and wrist immobilizer. Indication for this would be a true navicular fracture. Some would use it for a carpal tunnel, but mainly for a true navicular fracture. They like to support the wrist and the thumb in the same splint. Now, how do we measure for this? Again, I take my 3-inch elastic bandage, place it in the middle of the hand. Now, if the thumb is incorporated in that, 3 would be fine, but if it was not, then I would size up to 4, but I find on her hand, 3 would be okay. My length would be from the PIP joint, coming down, again, 2 inches distal, or 3 fingers from the antecubital. This is my measurement. Coming to my dispenser, pull it out. Now again, remember you pushed it back in, but still measure from the end. That's where you last cut it now. Okay, providing this is soft. Make sure that's soft. Cut it off close to the box. Take your 4 fingers, push it back into the foil, into the box, bring the door down till your fingers feel it, smooth it out. Let me see it. Stretch the edges and stretch. Again, as an option, you can open up the double-faced tape and cut that away if you like. But we find the stretching work just as well. Back to the PIP joint. Now what I do here, I'm going to bring this arm down here. Then right here in the wet space of the thumb, I make a little pinch. Again, you can use your pen and mark that. Okay. Here's my pinch. I'm going to come from the center of the splint, turn, make an oblique cut down to that pinch. Okay. Now what I want to do here, now I need a length to get the thumb involved. I don't need all this for the fingers. So what I'm going to do now is just remove this corner at an angle of the palmar crease. Just leaving my thumb here. And now again, because I created fiberglass edges here, I'm going to stretch the padding over my fiberglass. Stretching. Again, this is all done dry now, remember. Okay, now we see all this fiberglass on the edges here. Now, the padding won't stretch sideways, okay, only lengthwise. So to protect the patient from this edge, you want to open this up. Expose the fiberglass and just remove the edge that will be touching the patient. Just cut that off, okay? See that? Nicely padded here. Now, but looking here, see how narrow that is? I've sort of weakened it now. But the piece you just cut off, reinforce that. Close it back down. Now wet your splint. It's 3 inch, so I'm just going to come down the middle. Fold. Push that through. And then roll it up in your towel, squeeze. Do that a second time, roll and squeeze. Again, removing the moisture. You don't want these splints going on too wet. Now placing my splint on the patient. Remember, here's the MCPs, okay? That's why I cut it at an angle. Lock your splint in at the wrist. So capture my splint. I come through the wet space here, just like the volar splint we tend to do. And now, here's my wrist immobilizer. Now taking this piece here, come around the thumb and chase that with your bandage. Come around, down, towards the elbow, 50-50 coverage. Pulling on the splint, relaxing on the patient. Pull, pull, relax and roll. Pull on the splint, relax on the patient. 50-50 coverage. Pull, pull. And now, with the palm of your hands, you want to smooth this out from the center to the side. Center, center to the side, center to the side. And noticing here, one hand holds, the other one molds. Okay? Avoid traumatizing the patient, squeezing it. Stabilize the patient. Smooth it out with the palm of your hand. Now you see here, there's the wrist and thumb immobilized and one splint. This is our thumb and wrist immobilizer.